We are now going to be speaking with Dr. Devji Attellah, who is at the far end, and he is the SG Secretary General for the Kenya Medical Practitioners, Dentists and Pharmacists and Dentist Union, and also Peterson Wachira, who is the Chair for the Kenya Union of Clinical Officers. Thank you so much for making time for us.
Thank you.
I'll first welcome your remarks on the unfortunate incident at Malusi that saw the Nairobi County Management dissolve the board.
Yeah, thank you, Purity, and thanks for having us and for having this conversation about our health sector. I think it's very important, especially at this point. Let me start by saying that what we have just seen is one of the symptoms of an unfunctional public health system. What we have really focused on is how and where the lady delivered. And it's unfortunate. It's very unfortunate that she actually had to deliver at that point, whether it was by commission or omission. But the biggest issue here is not actually the delivery. It is that they only realized then that the baby had died some days prior. It was a macerated stillbirth, meaning that the baby had been dead in the womb probably 2 or 3 days prior. This was not noted. So that goes back to focus on how was the antenatal care? How was the antenatal care of this mother? And what access do they have? And what education do they get? So that they can be able to identify the danger signs and when to appear in a facility so that they can actually be checked. So as much as we are focusing on the outcome, and whatever probably came out, I think the biggest issue is the follow-up of this lady before she actually appeared there, because that is where the biggest failure was actually can actually be found. So even if this lady would have delivered in the ideal setting in the hospital, the baby would have still been a macerated stillbirth. So the biggest problem is that antenatal care and how we are educating our ladies so that they can be able to identify the danger signs and where to present. And when they present to that facility, whether that facility actually has the equipments that they require to be able to identify that actually we are having a problem here and we really need to act fast.
And Dr. that might have happened. Probably she had an issue with her clinics, but we see a viral clip where she's, I'm not sure what was happening because it was not on the ground, but she's denied, is it denied entry into the facility? Probably do you have information on what the management is saying, what was happening, why the gate was not being opened? Because she's visiting the hospital because she's sick, definitely.
One thing that this clip shows is we are most very active to issues. We do not have proactive approach to solving healthcare problems in the public. And that's why I agree with my brother that this is an indication that public healthcare is actually dysfunctional in the country, to the point that most of the leaders will react by transferring the medical superintendent or changing the boards. You can change as many as possible. You can change this every month or 2 months, but then if you don't go to the core of functions in the facility, then it can't work. Here, it is reported that the security person was struggling to open the gate with the padlock. In fact, he was assisted by some of these people that were here to enable entry. But you see, the whole issue has been now sensationalized, the point that it's now emotion-driven. One thing about Malusi is that we have seen these problems. Initially, with the Maureen, there was an aspect that there was no intensive care unit, there was no ICU. Now there's ICU in Malusi. But the aspect of shortage of workers is still in existence. So therefore, if the county can actually have deliberate aspect to revamp that facility going forward with having enough healthcare workers and everything, it's better off than the reactionary aspect that we are seeing of changing the board and changing the maid soup. Because it is the same way Mukumu case was reacted to. We have an incident where there's an outbreak of E. coli and Salmonella typhi, which I would say these are diseases that can be treated in any dispensary. But because the public healthcare is dysfunctional and things are not working, the sample was sent to Kemri. To the point that by the time the results were coming, we had lost lives. that is a clear depiction of a dysfunctional public health care in the country. And therefore, we need to come back, rethink, and have proactive approaches. Most of the times, we get emotional when these incidents happen, and time goes, there's calmness, and then we wait for another incident. Like Mukumu case, there was another case incident last 2022.
Yeah.
In Mamalusi, there have been cases.
Yeah.
In all public facilities, there are many cases that are not they're not known because nobody has taken a video of them. But ideally, the public sector, access to healthcare is actually very poor because the government has not prioritized healthcare as it should be.
All right, and we shall be getting to discuss more about why you're saying that the public healthcare is not functional, it's dysfunctional. Let's address the issue of the strike that you noticed that you issued last week. It's expected to start tomorrow. Maybe we can start from there. Is the strike still on or not?
Absolutely. We call it a walkout, and I think it's the same as strike. The reason why it's a walkout is because we do not sit with the employers or the governors to negotiate about salaries. It's just a matter of, if the salaries are not paid by 19th, as we had indicated, all the healthcare workers in the counties that have not paid, now 8 counties, will actually walk out from work. And their return to work will be dependent on the time the bank statement read that they've been paid. Because it's a demonstration that these workers have bills to pay, they have landlords to sort out, they have to fuel the cars, and they also have to pay to actually eat. So any governor or any county who will try to threaten the healthcare workers, then he has the prerogative to provide for them the basic needs, provide for them a house, provide for them food, provide for them transportation, take care of their bills, and they'll be at work. So essentially tomorrow, if Kisumu County, Mombasa County, Taita Taveta County, Vega County, and all these other counties have not paid the salaries to the healthcare workers, there will be none of them reporting to work. And we have given a 7-day notice as per the Labour Relations Act, Section 76, that says before any industrial action is undertaken, you give a notice. So it's actually a legally binding direction, meaning that the right to these workers, the right to work, and the right to be paid has to be paid by the employers. Yes.
And just a clarification before I talk to Peterson. Previously, you had stated that health workers in 12 counties. Now you said 8. Does it mean that the 4 have paid?
It's as of this morning, we just confirmed that Laikipia has paid, we confirmed Kisii has paid, Murang'a has paid, and Nyeri. And we said it's a walkout. It means that we don't need to say to the governors and ask, when will you pay? We just give a date, and so long as they have paid, then there's no any walkouts which are happening in those counties. But any of those counties that have not paid, we don't have to negotiate about anything. You just pay so that people can be at work. Yes. So
if they don't pay by the 19th, that means the strike begins on 20th?
Tomorrow morning, if they have not paid, there'll be no healthcare workers at work.
All right. Yes. How about for the clinical officers? Are we still talking about 12 counties, or they're also 8?
And actually it's the same. The notice is for all the health sector unions and societies combined. So the case is the same. And not actually tomorrow, after midnight today. For any county that will not have been paid, they're not going to have workers at work. We cannot be expecting people to appear for work when you have not facilitated them. And what we have also realized is that this is not a problem that has just started. This is a problem that came with the inception of devolution. There are many counties that do not pay in time. Some take even more than 3 months. And it appears to be deliberate. Like there is, I don't know why they want to hold workers' pay, but some counties actually hold workers' pay for some months before they can be able to pay them for whatever reason. And the law is very clear under the Employment Act that by the end of the month, you are actually supposed to have been paid for that month. So the government usually tells us to respect the law. And I think we are here now telling them that you must also respect the law. Yes.
And Daktari, the government says it found the coffers empty. So the counties have not received their cash. We've had a number of institutions, government institutions, the civil servants saying they haven't been paid. Probably looking at all this and what is going on, is this something that you could renegotiate and maybe wait longer?
Purity,
Yeah.
It's very clear. We can negotiate about everything. We are today, after this meeting, I'll be having the meeting with Council of Governors and Ministry of Health and Ministry of Labour, negotiating about our CBAs. But we don't negotiate about salaries because the people to be at work must be facilitated. They cannot work. They have to eat. And they have to pay, pay bills generally. And there's no way you can understand as an healthcare worker when all other workers in the civil servants have been paid. Because as we speak today, all the teachers have been paid, all the police have been paid, and all other civil servants. We know that before Easter, there was a very outcry from the members of parliament and the state officers that there was delay in their salaries. And it was indicated this is the first time in 70 years that happened. But we are experiencing these delays every day. They were paid, but we are still in this quagmire begging for these particular payments. And that's what made us realize that it is important that the right to pay workers must be prioritized by the counties.
Yeah.
And therefore, it is not our business to know where the counties are going to get money. If there's any inefficiency between the national government and the county government, they need to sort it out. But for workers, they have to be paid for them to be expected to be at work. Yes.
All right, and I'll be revisiting another strike that occurred, and some officials, especially KMPD officials, had to be jailed because of demands that the counties and the government termed as unrealistic. Yeah. So Peterson, let's look at what exactly you are demanding. Are we talking about the March salaries only that are delayed, or is it February, March salaries? What exactly are we talking about? I also saw in the statement that you had issued, there was salaries, and also are they statutory deductions as well? Maybe you can tell us what exactly are you demanding. If, for example, tomorrow you have one salary paid, are you likely to go back to work and to call off the go-slow?
No, I think what we are demanding is up to date. You must have paid up to the March salary. And even going forward, any county that does not pay by 5th, on 6th, we are going to have a walkout. Because we have realized that this is something that has now become chronic. The other bigger problem is about the statutory deductions. So you find that somebody has a loan. They're supposed to, the county government is supposed to deduct from their salary as they pay them and remit to the bank, but they don't do that. So when this person is paid, whatever they're paid by the county, then the bank will take that from their account. And so people are really suffering. They also don't remit KRA. So sometimes because of the banks and the KRA, you are blacklisted. You cannot even be able to get loans when you are not paid. And they are also not remitting for NHIF. So we cannot even access health services. Our families are unable to access health services, especially our members under the counties. So the two things, the salaries and the reductions, is what we are demanding, that they must be paid and paid in time. And that must also happen going forward. A county like Embu, for over 1 year, they have not been paying deductions. You can imagine what is happening to their families. Their salary, whatever they are being paid, the bank, of course, is going to take its part of the loan. And so our people are really suffering. And even as we look at that, we must also look at the mental health of these people. We are subjecting our people, our health workers, to social embarrassment, which of course brings in mental anguish and mental health issues. And that is why we are even seeing ever increasing cases of substance abuse and depression, even to the level where we are seeing suicide among our officers. You remember the doctor in Machakos, the nurse who was actually a specialist in mental health, I think from Gatondo Hospital, who also committed suicide, and the others that we have been able to record. So this must be looked at beyond the money to the consequences that these people suffer. And when you are being treated by a medic who is frustrated, who is stressed, who is depressed, then are they going to see that patient with clarity and give a proper diagnosis? They can't, because they are mentally clouded. So it's also the patient who is going to suffer from the same, because that mental anguish, that depression, that frustration will make the clinician not to diagnose well, we are going to get complications, and the whole cycle of the cost of healthcare and the poor outcomes in healthcare then continues.
Yeah.
So if our government really believes that health is an essential service, they must treat health as an essential service, whether under devolution or not. They must ensure that everything is running, and it's running in the way that it's supposed to be. Because even if we present ourselves in facilities today, there are no medications, there are no drugs, there are no essential supplies, there are no reagents for the lab. So people are still having to go out there and procure some services from the private sector, even if they're being seen in a public health facility. And some of them cannot even be able to afford. So financing of healthcare, the whole spectrum of it, is something that must be given priority, and it's something that we are not seeing the government giving priority.
Yes. And Dr. For the counties that are yet to pay, is there any commitment that they have probably communicated with the unions that they are going to pay by this time? We might not pay by the 19th, but we can pay by this time. And number two, you had an issue with only counties. This means that for doctors and medics that are working in the national government, they're okay, they have been paid. That's what it means.
Essentially, they have been paid, those working in the ministry. But you see, we do not have any dates that have been given by the county governments when they'll pay, because it is not a one-time thing. It's a recurrent problem. As I said, you see some counties were paying February salaries in April, and some are paying January salaries in April. So it is a consistent problem that is there. It's inherent. And now we are saying we have to get a cure for it. The only thing that workers have to bargain with and not to look like beggars from the employers is their skills. And then the chance they have to withhold it is that to call for the employers to understand that they also have a right. That's why we are saying we do not care about the dates that any county government has in hand, but for those dates that they're planning to pay, that's when they'll have workers back to offer their services. So it's actually an issue. The other thing that happens is that this issue of salary is just the tip of the iceberg in what's happening in the counties. Counties' healthcare is actually in disarray. It's totally dysfunctional, because if you cannot pay healthcare workers who you consider to be essential, are you going to be able to pay the suppliers to make sure that there are essential drugs in those facilities? Are you going to buy reagents? Are you going to employ? That's why it's been a mess over this period. We have an increased shortage of healthcare workers in all the facilities in the country, but there's no plan to employ any by any of these counties, because they complain about the finances. And that's why for us to have a functional healthcare, we must be honest and objective and really look into how can we have a centralized health service commission, or a centralized point for the salaries for healthcare workers that is devoid of money coming from the treasury to the county banks and then to the employers. That's what we're going through. And the governors must actually accept this, because it's been a recurrent issue. As unions, we've sat and we've agreed. We have given a permanent notice for 5th, meaning that every 5th, as my brother said, if there's any county that has not paid, we'll just be out by law, so that it be a priority that as we treat other civil servants, as we treat other workers, then healthcare workers need to be treated the same way. Yes.
All right. And just before we get into other issues that are affecting, because you're saying that it's not, the healthcare system is not really functional as we speak. We have a new government. Probably from where you sit as unions, do you think there is a goodwill to engage with the medics? Because previous regimes, we've had strikes day in, day out, and complaining about unhonored CBAs, complaining about shortage of workers and also pay. They're not being paid well. Do you think, would you say there is a goodwill? Have you had engagements probably with the new leadership at county level, at the national level, so that you bring these issues to an end?
As KMPDO, as the union, we gave a notice of intention to strike that was to begin on 6th of January. But since then, we've been having multi-sector negotiations with the Ministry of Health, with the Council of Governors, with the Public Service Commission and the SRC as a team to really look into an implemented collective bargaining agreement for the doctors. But ideally, we have been having these discussions, and that made us to really suspend the intended strike at the time. We are hoping that the final meeting today will bear fruit on that matter. But then if it doesn't, then we actually then can now judge the government on its direction. Because it was a new government, and they asked us to give room to dialogue and negotiation over the issue. And that's why we complied to it. But then, based on the outcome of this, if it happens that the agreements that we put forth are not met, then we can now say it's the same one as the previous one. Whereby, and most of the time, Peruti, I will tell you that there's no any employer who will increase the salary of an employee smiling. There's no any employer who is happy to pay employees in a happy mood. It has always to be a struggle. It's a struggle of the workers to actually stay together and force the profits from the employers to be divided for them. We know very well that we have like a SRC. SRC has specialized in ensuring that there is no increased salaries for workers in the public sectors. But you've seen what they're doing for state officers. It's very different. And this issue that there's cash crunch in the country, that there's no money, is, I would say, is an illusion. Government cannot be broke. We have just seen an increase 8% in the tax collection. We pay taxes every day. So government can't be broke. It's always the aspect of priority. And that's why we say the county government cannot say they don't have money. They cannot say that they're waiting for money from the treasury. If it is impossible for them to get there, they should there's an article in the Constitution that gives them a leeway to actually return workers to the national. And one thing also that comes is that we are in one government, both national and county government, and therefore if there's a priority to have healthcare function, it will function. But as it is now, there's more deliberate effort to ensure that it doesn't work, so that everything can be privatized. Yeah.
All right, and before I let you go, because I'll still be here with Wachira, probably you meeting with the ministry as doctors, experts have been advising really the medics to have a commission, just the way we see teachers, the teachers having their own commission, so that you speak as one voice. And we've even seen when medics are going on strike, doctors will go on strike, but the nurses are still working, the clinicians are still working, for instance, but still it cannot work. Is it time that you front such discussions even as you meet with the government today?
We have actually, as unions in the health sector, that is the doctors' union, nurses' union, clinical officers, nutritionists, lab, and civil societies, we've had a sitting, and we say that we are tired of asking the political leaders to amend the constitution and to allow for the Health Service Commission. We started what we call a popular initiative of amendment of the constitution, and as we speak today, we have almost 5.9 signatures that have been collected, and we believe that by June we'll have almost 7 million, and we have a plan to actually initiate a constitutional review or amendment to the popular thing, and we'll present this to IEBC. And we believe that this will be a clerical call to the government that actually the right direction that the Kenyans want is the Health Service Commission. This government made a promise in their manifesto that they will be the mediators between the healthcare workers and the counties regarding the formation of Health Service Commission. And I believe, based on the way the president has been talking, he has a good interest to have a functional healthcare that is accessible to all, regardless of the socioeconomic status. And therefore, he has understanding that Health Service Commission will make it happen. Because as it is now, priority, we cannot have a functional healthcare when the president has to consult with 47 governors. He may have a good dream, but it will not work, because there's different decision-making aspect, something can be pushed in. So Health Service Commission will ensure that finance for healthcare is ring-fenced in that Health Service Commission for the health workforce. Just the same way we are for the military, and just the same way we are for teachers. And there can be a plan for annual recruitment.
Yes. Right, and we continue this conversation shortly. We now want to take a quick breather. Remember, we're talking status of the healthcare in the country, even as medics in now at least 8 counties are planned to go on strike tomorrow. That's the 19th of April, following delayed salaries. I'm in studio with Dr. Devji Attellah, who is the Secretary General, Kenya Medical Practitioners, Pharmacists and Dentist Union, as well as Peterson Wachira, who is the Chairperson of the Kenya Union of Clinical Officers. Stay with us. We are back shortly.